Hi, my name is Judy Belk, and I'm the very new president and CEO of the California Wellness Foundation. I think it's one of the best jobs in California. I've only been on the job for 4 months, but for 8 years, Cal Wellness has been a proud partner with the Phil Research Corporation sponsoring the Cal Wellness Phil Health Policy Survey. It's an annual poll where we hear directly from California voters their views, their concerns, and their opinions on how well the state is doing in meeting the health needs of Californians through public policy solutions. You know, this year's poll really takes on more significance than ever, in that it comes on the heel of the rollout of the historical Affordable Care Act. Although I have spent most of my professional career in California, I'm a Virginian by native. I grew up in Alexandria, Virginia, outside of Washington, D.C. Both of my parents worked in government. But more than anything, because of my Southern roots, I'm a storyteller, and I see stories everywhere. And I think this year's poll really tells an interesting story that we're going to try to share with you today. But for me, really, the story began with a pretty depressing storyline. A year or so ago, too many folks in this state did not have access to health care. Today, over 3 million additional Californians can get the care they need to live healthy, thriving lives. And according to this year's poll, the story did not go unnoticed by California voters, who can be pretty skeptical in terms of the role of government. But they provided through the poll a major vote of confidence in the rollout efforts of ACA. And as you know, in many parts of the country, it was a different storyline. In a few minutes, we're going to hear from Mark DiCamillo, who is the Senior VP of the Phil Research Corporation, and I think the master storyteller of the Phil poll. He's going to peel the onion for us. He's going to help us gain better insights behind the numbers and really inside the heads of California voters. Then we have a triple treat for you. We've got a distinguished panel: Diane Dooley, who is the Secretary of the California Health and Human Services Agency; Peter Lee, the Executive Director of Covered California; and Daniel Weintraub of the Healthy California Online Service. These folks have been working very hard in not only rolling out the ACA, but also telling the story, a story that, at least from the poll, it seems that many Californians heard about. You have their bios. We're going to try to have a conversation. We're going to try to think of the 4 of us, 5 of us sitting around the table and having a few of our 80 or so friends observe us. We're going to try to provide time to engage you in this conversation. You have cards in your packets. Please think about questions that you might have, and we'll try to get to as many of them as we can. We'll also want to get your thoughts about today's event, so we also have an evaluation form. But before bringing Mark on, I'm just curious, how many folks in the room actually work for government? I mean, you're actually on the government payroll. Great. Raise your hand. There you go. Don't be shy. As I said, I grew up in Alexandria, Virginia. Everybody I knew practically worked in government. My life was changed by the work of government in terms of me being able to go to public schools, getting a college education, even getting access to running water. All of that came about as results of policies and innovation from government. We tend to think a lot about government as this huge thing, government. But to me, because my parents worked for government and folks that were in my neighborhood and my life was changed by government, I really think of government as really a group of people, people like many of you here who really work hard. I know you're not in it for the money. Work really hard because you believe, as I do, that maybe there's a way to make a living and help in the broader common good. So I just want to acknowledge the work and the contributions that you do, which you might ask, why would a philanthropic organization, California Wellness, why would we be invested and interested in helping you and others across the state have a better understanding of what citizens think about government. We do sit on a lot of resources. We give out about $38 million a year, have a great team where we get up every morning trying to really think about how we can improve the health and wellness of primarily underserved folks around the state. But with all of the money that California Wellness, California Endowment, California Healthcare Blue Shield, and many of our partners who are working in this space, it's small, very small, insignificant to what government can do to shape the lives. And if you have any doubt about that, all you have to do is look at what the impact that the affordable health care, the historic landmark public policy, has done in terms of impacting the lives. All the philanthropic dollars added up together could not have brought about those changes. And I know that that couldn't happen without many of the folks in this room and working in government. So Cal Wellness really stands with government in really fulfilling our mission in trying to help provide services to the underserved. But as many of you know, and I think that's probably the story of government, the story hasn't ended yet. There's still about over 3 million folks who could benefit from the Affordable Health Care Act that at least we continue to think about at Cal Wellness. We believe deeply, for example, that one should have access to health care and it shouldn't be determined by the immigration status. We'll be looking at ways to address that with others in the philanthropic field. But now, I do want to turn the stage over to the master storyteller. I just had the opportunity to meet Mark, and I was just fascinated, and I'm not even a policy wonk. The numbers fascinated me. It's a great story. I can't think of a better partner that we've had over the last 8 years. So can you join me in acknowledging Mark? Thank you.
Good morning. It's always a pleasure for me to come to the state capitol. I really do, first of all, want to thank the Wellness Foundation for its long support of this annual survey. You know, in the polling world, a time series study like this really lends perspective on any given poll. I mean, you can interpret this year's numbers with much greater clarity because we have all of these prior measures. On the Affordable Care Act, they go back 5 years. On some of the broader health policy measures, it actually began 8 years ago. So we can see where we are as long as we can see where we're coming from, and I think that's an important part of this study, and we're very grateful to have had their continued support over the years. Okay, let me just talk a little about how we did this survey. It was pretty much in a comparable methodology as prior year's surveys. It's a survey of California's registered voter population, and that's important because there's a broader population of adults who are not registered voters, who are obviously, many of whom are not citizens, but these are folks who are all citizens and registered to vote. It's a random sample. We interviewed over 1,500 of them, and we also, in order to get a better, clear view of the opinions of Asian Americans, we augmented the sample among Asian Americans so that we got a good sample of Chinese Americans, a good sample of Vietnamese Americans, a good sample of Korean Americans, a good sample of Filipino Americans, and then we merged them together because they're very different cultures, very different backgrounds, they have very different political perspectives. In order to get the Asian population properly measured, I think that's the optimal way of doing it. We've done that in prior years as well. Obviously, after we complete the survey, we bring the total population of Asians down to their actual true numbers, but we included a bigger sample of them. The interviewing for this survey was done in late June through mid-July. We interviewed people by both cell and landline telephone, and in fact, increasingly, more and more of the interviews that are done by telephone are done on a cell phone. A majority of all the interviews in this survey, I think it was about 60+%, were done with people on their cell phone. The languages, we offered 7 languages to people, and when all was said and done, we interviewed 368 people in a non-English language. That was primarily Spanish, but also the Asian Americans, especially because we augmented the sample. Many of them answered the questions in their own languages. The overall findings are quite accurate in the sense that a sample of 1,500 is plus or minus 2.6 percentage points on the overall findings. Okay, on the first measure, which is the kind of the big measure to look at current California opinion toward the Affordable Care Act, first of all, you see that supporters outnumber opponents. And this year's numbers show 56% of California voters supporting the law, while 35% were opposed. And what you see in the little triangles, those are the deltas for the change from last year, and the change that we saw from last year were both at the extremes. There are now more people strongly supportive of the law than there were last year, and there are fewer people strongly opposed. And if you look at the trend over time since the law has been passed, it's fairly remarkable to me in the stability of attitudes on this law. You actually see that in the national polls as well, but the stability is on the negative side. Here in California, it's on the positive side, and for the first time, we actually are seeing a slight change, and this is statistically significant, slightly higher support level this year, a little less opposition than in prior years. And so why is that? Well, you can see it when you look at the various subgroups across the state's population. Many of these subgroup differences were prominent in each prior survey, but let me just point out a few things. First, on the regional basis, it's not surprising that the San Francisco Bay Area and Los Angeles County would be the strongest in their support. They're the most democratic areas of the state, and as you can see on the bottom, the biggest predictor of how you will view the Affordable Care Act really relates to your party orientation. Democrats are supportive of the law greater than 5-1. Republicans are opposed greater than 3-1. Those partisan differences exist all across the country. One of the main reasons why California is more supportive of the law than the rest of the country is we have many more Democrats here than Republicans. But one thing that's important to note in this table is where are the biggest changes compared to last year. And I find this one of the more interesting aspects of this year's poll. On the plus side, the biggest gains in support are coming from the Central Valley, and that's the entire region from Shasta all the way down to Bakersfield. And then other Southern California, which is mainly the Inland Empire. Both of those are showing significant increases in support, and if you look at the left-hand side, significant declines in opposition. Now, these were areas that last year opposed the law. So now we're showing pluralities, not large pluralities, but still pluralities in the Central Valley and in the other Southern California region in support of the law. So softening of the opposition in areas where there had been a greater opposition than support. The same thing is true when you look at party registration. Even though Republicans are 3-to-1, more than 3-to-1 in their opposition in California, that's actually down from last year where it was greater than 4-to-1. Republicans actually went up 5 points in their support this year and went down 6 points in their opposition. So that's an interesting finding. The moderation of opposition is really what was contributing to the increase in the support level this year. Now let's look at the other factors that contribute to support or opposition. One of the other major differences in California is the race and ethnicity of respondents. It's always been the case that the state's ethnic voter population has been very supportive of this law. We see it again this year. Really not a lot of changing going on among that population, but what is interesting in this chart, at least for the race ethnicity numbers, is the change that we're seeing among white non-Hispanics. Again, this was one of the population groups that last year there was more opposition than support. And now, among white non-Hispanics, which now comprise about 60% or so of the state's registered voters, we're seeing more support than opposition. So again, a moderation and an improvement in outlook toward the law among groups that previously had been opposed. And you can see the differences by age. You know, it's actually flattening out. What had happened in prior years, we had seen a little less support for the law, especially among older voters. That's now kind of becoming more uniform across the age sectors. Here's an interesting slide which shows the views of the Affordable Care Act by the insurance status of the voter. If people remain uninsured, they still have more negative than positive views of the law. So these are people who remain uninsured this year after its rollout. All right, but when you look at the insured population, there's greater support than opposition, and it's greatest among those who are insured through the Medi-Cal system or through the individual market, which expanded this year because of Covered California. And that's interesting because both of those areas were kind of target areas for the enactment of this law. Okay, we also have asked this question in the past because the debate continues in Washington as to what to do about the law. And actually, this is a question that we took from the Kaiser Family Foundation national surveys and just asked it here in California. We've been doing that for a number of years. And we're basically offering people the option of what would you like Congress to do with this law? And here in California, the dominant group is to expand the law. That's certainly not the case nationally, but here in California, 43%, the largest proportion, favor expanding the law to make it do more. And that actually went up 5 points this year. Keep it as it is, that's 12%, about the same as it was in prior years. Repealing it is something that you in the national polls you see almost get close to 50%. Here in California, either repealing it completely or repealing parts of it, it only touches about a third. It's 36%. Okay, because of when we were doing this poll, we did it, most of the interviewing was done in early July and through mid-July, although it had started in late June. We also asked about the Affordable Care Act's requirement that private health insurance plans cover the full cost of birth control because at issue before the Supreme Court was the Hobby Lobby ruling, which eventually came down and I'll show you the next slide in terms of the public's reaction to that ruling. But here in California, when you ask people whether private health insurance plans should cover the full cost of birth control, they're very much on board. 2/3 of voters say that. There are partisan differences about this issue. Democrats and nonpartisans clearly are holding sway. 83% of Democrats in support, 68% of nonpartisans. Republicans, which are now about 28, 29% of the state, only 39% are supportive. And here we asked specifically, once the ruling came down, we asked the voters what they thought of the U.S. Supreme Court's ruling that allows certain employers whose owners object to birth control on religious grounds to be exempt from the Affordable Care Act's requirement to cover the costs of prescription birth control in their company's health plans. Here you can see that Californians oppose or object to the or disagree with the Supreme Court's ruling. They do so by about a 5-3 margin, and again, it's mainly party driven. You can see Democrats and nonpartisans are most likely to disagree, Republicans less so. One of the big findings from the survey had to do with just voter perceptions of the way California has implemented the law. And in order to give us some perspective, we compare it to how Californians think the federal government has implemented the law. And as you can see, many more people believe the state has been successful than the federal government has been successful. 60% of Californians say the state of California has been either very or somewhat successful in implementing the law. Just 30% saying that it has not been successful, so it's 2-to-1 in viewing that the rollout has been done successfully. Among voters here, when you ask them about the federal rollout, it's almost an even division, with 49% saying the federal government rollout was successful, but 46% saying it wasn't. So a big difference. California is much more positive about how we've rolled out the Affordable Care Act and enacted it here. We also asked voters their opinions about specific objectives that are embedded in the law and whether the state was successful in meeting each of these objectives. And for many of them, there is much greater belief that the state has been successful. First of all, encouraging more previously uninsured residents to get health insurance coverage. By almost a 3-to-1 margin, Californians think the state has been successful on that objective. Expanding Medi-Cal to extend health insurance to more low-income Californians, very similar, it's about 3-to-1. Providing California consumers with more insurance choices, 57% believe the state's been successful on that, 31% saying it's not. Obtaining the federal funds needed to implement the law, 51-24, about 2-to-1. Believing it's been successful. Providing health insurance buyers with better consumer protections, 50-28. Establishing a one-stop place where it will be easy for consumers to shop for health insurance online, 50-32. Most people think the state's been successful in that area. The one objective that most voters, or that a minority of voters, just 37%, think the state has been successful in meeting, is limiting the rate increases that insurance companies charge to their customers each year. And we'll be talking a little more about perceptions of Californians about the cost of health care in some of the other poll numbers, but that is the one area, and it's going to dovetail as we look ahead to the Proposition 45 numbers that hit the papers this morning that were a part of this survey, and I'll review those numbers, but things that relate to rates, people are still looking for solutions or just answers of what they should be able to expect in the future, and they want some rate relief. Okay, in the survey we asked voters the difficulty they had in paying for health care. So this is just their own personal situation. And what you find is that about half of voters, 46%, describe the costs, paying for the costs of health care as difficult. 17% say very difficult, 29% say somewhat difficult. That compares to 52% who say it's not too difficult. But what's interesting, if you look at the change compared to last year, it was a question that we posed last year, the proportion who say it's very difficult actually declined 4 points. That's an encouraging sign. I mean, this is not a graph that I think is going to change overnight. If you polled on this again and again, I think you'd probably get very slow changes. But the change that we observed this year anyways is a change in the positive direction, with fewer people saying it's very difficult. Now let's look at the people who are saying it's difficult, and here is what you see. The darker part of the bar is the proportion who say it's very difficult, and the lighter part is somewhat difficult, and they add to the total. The people who are still remaining uninsured in California are the most likely group to say it's difficult to afford. 73%, with 46% of those people saying it's very difficult. If you look at by other insurance status measures, you can see that the difficulty still is greatest among the Medi-Cal population and among the individual market population, which again was kind of the target audiences for the Affordable Care Act in many respects. They are having the most difficult time, but still, look at the change from last year among those two segments, which was the target population for the law. 13-point decline in the proportion of Medi-Cal voters who say it's difficult for them to afford. So it used to be 63% last year, it's 50% this year. And the same thing with the individual market. It was 60% last year, went down 8 points to 52% this year. So an encouraging set of differences. Okay, we also trend or asked voters about last year. Compared to last year, you know, does the amount that you're paying for health care to go up, go down, stay about the same? And here we find that 47% of voters say that the amount they pay for health care this year has gone up. 40% say about the same, 9% say it actually went down. The change, again, is in the positive direction. The proportion who say it went up actually declined 3 points, and the proportion who say it went down actually went up 4 points. So fairly encouraging set of data, although, you know, it's still a problem. And when you look at that by income, it's interesting that the people who are most likely to say their costs went up are the people who are middle income to upper income Californians, because probably they weren't affected too much by the Affordable Care Law. Especially the 100,000 or more income segment, 63% said their health care costs went up last year, just 6% say they went down. At the lower levels, you can see that most of the voters, at least at the lowest level, the under 20,000 level, 52% said that they remained about the same. Okay, now let's turn our attention to Covered California, because this was the first time we had an opportunity to evaluate the voter responses to the rollout of Covered California. In previous years, especially last year, all we could do was ask about voters' expectations about Covered California. Now we actually have some experience behind us. And so first of all, how many voters said they themselves personally went to the website to check out the Covered California website? 36%. Now, I have to say that you can look at this number a number of ways, but from my perspective, that's a pretty high number for a one-year rollout. At least that would be my take. I've seen a lot of rollouts that, you know, you're trying to influence 17 million Californians. That's how many registered voters there are. If a third, well, these are actually the voters under age 65, so we're talking maybe about 14.5 million, but still, 36% actually took the time to go to the website to look at it, and of those, 9% said they actually got their insurance this year through Covered California. And if you look at then the subgroups of who was most likely to have gone to the Covered California website and who actually said they purchased their insurance through the website, not a huge amount of differences by party, although I think it is significant to note that Republicans are the segment, at least by party, the least likely to say that they actually got their coverage through Covered California. I think they're a tough group to make a sale to. They are very skeptical about this law, so getting Republicans moving forward on this is one of the challenges that remains. Interesting, by age, we see that more people aged 30 to 39 said they visited the site, although their take-up rate was no greater. It's about the same as what you see in the 18 to 29-year-old group. It's interesting, too, that the segment 40 to 49 was least likely to have had a take-up rate. Perhaps that's because they're most likely to be employed and maybe have their own coverage. But it's also interesting that it went back up among the 50 to 64-year-old segment. That went up to 9%. Here's an interesting set of numbers, and I think it speaks to some of the challenges that remain for Covered California. When you look at the proportion of voters who say they went to the Covered California website by race and ethnicity or by the language in which we conducted the survey. So they preferred to be interviewed in their own language. They're a non-English speaker. They preferred to be interviewed in English. They're an English speaker. First, by race and ethnicity, the smallest, the group that had the lowest proportion saying that they went to the website were the Asian population, which is interesting. Again, we had a very large sample of Asians, so I think this is a good measure. And why is that? I think it's because the non-English speaking Asian population were not, were not as aroused at going to the website. Perhaps it was outreach, I don't know, but the preferred language, the non-English component, is mainly driven by the Asian language speakers. The Spanish language speakers, the difference is not nearly as great. We're talking about the Chinese, Korean, Vietnamese, and Tagalog speakers who were less likely to go to the site and certainly less likely to take up insurance there. So it's a challenge as we move forward. Also, big differences by education. The people who are less likely to have gone to the site are clearly people who have lower levels of education. If you're a high school grad or if you've not graduated from high school, only about a quarter went to the website. Now, you may also have to keep in the back of your mind, this population is probably less likely to use the internet. So that's something to consider because it's a harder to reach population. If you're not online, it's going to be difficult for these people. They're going to need assistance. Also, when you look at insurance status, the big difference here was among people who were continuously insured. So they are much more secure in their insurance over time. They've had insurance continuously. They and their families have had insurance continuously over the past 2 years. If that was not the case, however, if you had some interruption in either your own health insurance or one of your family members' health insurance, much more likely to have gone to the website, much more likely to have taken up the insurance there. The uninsured, those who remain uninsured, half of them said they went to the website, but they didn't get insurance. It's interesting. This is one, I mean, when I looked at the data, I don't know about you, I'm always fascinated by these little sidebar stories when I look at data. Here's an evaluation. It was a fairly simple, straightforward question. Were you satisfied or dissatisfied with your experience, something like that, when you went to the website? And these are only the voters who went to the website. So it was asked of about a third of the voters in the sample. 56% said they were satisfied, 42% said they were dissatisfied. That doesn't seem all that enthusiastic, but what's driving that? What's driving that are perceptions that voters bring to the website. At least that's my interpretation. It's like a Rorschach test. If you come to the website as an opponent of this law, you're not going to like the website. If you come to the website as a supporter of the law, you tend to like the website. So, you know, it's the same website for both people, but it's viewed very, very differently. And it's just a fascinating set of numbers, at least from a polling standpoint, if not a public policy standpoint. Okay, we also asked voters their future interest in going to the website next year. And again, similar kinds of results. 46% said they are interested, 51% aren't. But the differences really lie in whether or not you're a supporter or an opponent of the law. If you're a supporter of the law, you're much more inclined to say you're interested in visiting the website. Or if you're an opponent of the law, you're much less likely. And again, Republicans, much lower because they're more likely to be the opponents. Okay, another set of findings that came out this morning that I think deserve attention and are very important from a public policy standpoint. First of all, remember, this is a sample of registered voters. It's not the overall general population. We're talking about these people are all citizens and they're registered to vote. When you look at the trend line of the proportion of voters who say Medi-Cal is important to themselves or their families, and I would consider that to be families broadly defined. Could be your nephew. It doesn't necessarily have to be your immediate family in your household. You see that the proportion who say it's important, that Medi-Cal is an important program to themselves and their family, has been going up. Back in 2011, 51% said Medi-Cal was important to themselves and their families. Last year went to 58, and now it's at 62%. I think this is a very major finding. This is no longer a small segment of the voting population that benefits from Medi-Cal. This is a safety net program that has now reached the masses, and it has a broad constituency. And when you look at the subgroups on this question, here we're kind of focusing in on the proportion who say very important. It's very interesting and very different across subgroups of the population. Obviously, the Medi-Cal population themselves, very likely to say this is a very important program to them. And it actually went up 6 points. It's at 84% of the Medi-Cal population saying very important, and most of the rest said somewhat important. And it also relates directly to income. The lower levels of income, much more likely to say this is a very important program to them and their families. And when you look at the race and ethnicity of the voter, you see a huge difference in California. You can see that the ethnic population's much more inclined to say that Medi-Cal is a very important program to themselves and their family that spans Latinos, African Americans, Asian Americans. Majorities of each of those populations say it's very important. That compares to just 29% among whites. So one of the factors that may be contributing to the growth in the importance of Medi-Cal over time is actually the fact that the ethnic populations are the fastest growing parts of the California population, even among the voter segment. So I don't think this is going to slow down anytime soon. We also asked about the voters' perceived success of the Medi-Cal program in meeting its objectives. We've asked this before, and in every poll that we've done, voters have said it's been a success. In 2011, 64% said it was either very or somewhat successful in meeting its objectives. Same thing last year, 64%. It's 65% this year, so very little change over time, but pretty much a positive assessment of the Medi-Cal program and meeting its objectives over time. And if you look at the perceived success numbers, and this is the proportion saying it's been successful. You can see the Medi-Cal population, 85% saying it's been successful. Democrats, but even a majority of Republicans, and I find this interesting, they're finally agreeing that it's an important it's been a success. It's not something that is, bloated government, a waste of government taxpayer dollars. The ethnic populations, especially Latinos and African Americans, most likely to view this as a success, but even white non-Hispanics who are a little, say it's a little less likely to be very important to their own families, they still believe that Medi-Cal has been a success in meeting its main objectives. One of the questions that we've asked over time, and this goes all the way back 8 years, and it's actually the very first question in the survey, so we're trying not to affect it by any of the specific measures in the Affordable Care Act or any of the other topics that we're going to address in the survey. We just basically start out the survey saying, how satisfied are you with the way the healthcare system is working in California? It's a good warm-up question, but it's a nice trend measure to get as well, because it's very broad. And here you can see that in each of the previous year's measures, we got bare majorities, 50%, 51, 52%, saying that they were satisfied with the way the healthcare system was working in California, while 40% to 46% were not satisfied. So it was about a 5 to 4 margin in each of the prior surveys. That's changed, and it's changed for the better. It's now about a 5 to 3 margin, 56% saying they're satisfied, 34% saying they're dissatisfied. So I would, again, attribute this to what's changed. Well, the Affordable Care Act has been enacted and is now fully enacted, and it appears to have had a beneficial effect on voters' overall view of the way the healthcare system is working in California. So another good news set of findings. If you look at satisfaction by segments of the population, the satisfaction is greatest among the lower income populations. 67% are satisfied among those earning less than $20,000. That's gone up 13 points over the past year, so a big improvement from last year. Same thing with those earning $20,000 to $40,000 at 62%. That went up 10 points this year, a big improvement. And you can see the proportion who are dissatisfied among those two segments went way down. So the target audiences, the target populations for the Affordable Care Act, much more satisfied with the way the overall healthcare system is working in the state. And not surprising at all, the ethnic populations more likely to be satisfied than dissatisfied. Each of the Latino, African American, and Asian American segments, greater than 6 out of 10 now satisfied, and fewer than 30% are dissatisfied. It's one of the more controversial. We asked voters a number of things in the survey that had to do with improvements or changes that could be made to the Affordable Care Act, either here in California or at the national level. Just how would you tinker with California? Most voters want to expand it. So what do they think about specific policies that have been proposed? Here's one that is probably the most divisive. It's probably, but I find it interesting that 51% are in favor of expanding Medi-Cal, preventive health care services to the state's undocumented residents. Again, this is the voting population saying this, 51 to 45. The opposition, however, includes a fairly significant segment, 32%, who are strongly opposed. And when you look at it by subgroup, you do see big partisan differences. Democrats are much more likely to be supportive, about 2.5 to 1. Of Republicans, 3 to 1, maybe almost 4 to 1. It's 3.5 to 1 against. It's a very partisan issue in this state. But the nonpartisans, which often are the swing voters in California, are siding with the Democrats, 53 to 41. And I would hazard a guess, and I do recall having asked this question, perhaps not exactly in this form, but we asked this question in a prior survey about 6 or 7 years ago, and there was more opposition than support for the idea of insuring the undocumented residents. So it's something that needs to be watched over time. You can almost see in these numbers why this particular proposal wasn't enacted this year, although it was raised in the legislature. It's something that divides the public. And you can see where the divisions are, both by party and by race and ethnicity. The ethnic populations are much more inclined to support this idea, and I find it interesting that not only Latinos are supportive, but it's not an issue that just the Latino populations are out there because it affects them and their families more. They're also joined by African Americans and Asian Americans. So it's a pretty powerful combination. Again, they account for about 40% of all the voters combined. The white non-Hispanics remain opposed. Here are some of the other proposals that we had, and all of these were much more likely to be embraced by voters as good ideas. The idea that we should encourage insurance companies to reward doctors and hospitals more for the quality of care they provide than the number of patients they treat. 82% like that idea, if somehow you can make that happen. encourage insurance companies to try to reduce healthcare costs by allowing physician assistants and nurse practitioners to play a bigger role in providing care. 81% think would favor that. Expand state funding for not-for-profit health insurance co-ops. 78%. Allow insurance companies to offer a new lower-cost, high-deductible coverage option through the Covered California Health Insurance Exchange. So, you know, trying to offer something that's a little more affordable. That is popular. Again, this theme of affordability does come through as a potential problem or a potential for doing things. And here you see those results in a proposition that will be on the ballot this year. It's Proposition 45. It's called the Approval of Healthcare Insurance Rate Changes Initiative. We basically read them the official ballot summary, and here's what we got. 69% in this poll that was done again in late June, early July, that's a very early measure for something that's coming up in November, said, sounds like a good idea, I'm inclined to vote yes. They want some rate relief. 16% inclined to vote no. And as you can see, there weren't huge differences by party. Voters, Democrats more likely, but even a majority of Republicans said they were inclined to vote yes. Now, the field poll, on its own, because we work for the media, will be tracking voter opinion on this throughout this campaign. As the campaign arguments start, there's going to be a lot of money spent on this initiative, as is going to be on the next one I'm going to show you about doctors. And, you know, we've polled on proposition elections. I polled on them my whole career. I started at Field in 1978. I probably polled on over 200 ballot propositions in California. And my experience with ballot propositions is this. If a ballot proposition starts out behind or even, it has very little chance of passage. It has to start out with a lead in order for it to have any chance of passage. I mean, there are a few exceptions, but usually they relate to confusion about what a yes or no vote means. But when a proposition starts out ahead, the experience of the field poll is that about half of them pass and about half of them don't. So I would put this in that broad category. Even though it's overwhelming in its support, it really will boil down to the campaign. It starts out ahead with a very strong yes side inclination, and as you can see in other aspects of the poll, voters are of the mood that they would like some rate relief. And here's a proposition coming along that says it can do that. I think the chances are probably better than even that it may pass, but it's not a slam dunk, as the numbers might indicate in this measure. Similarly, we got high levels of voter support for Proposition 46. This was also about health care. It's drug and alcohol testing of doctors, but it's also and mainly about the medical negligence lawsuits, raising the cap from $250,000 for pain and suffering, or for a legal challenge to doctors, to increase that. So it's really the trial lawyers against the doctors on this. And I even started hearing some of the ads on the radio yesterday as I was driving home. So this campaign is just now starting. 58% inclined to vote yes, 30% inclined to vote no as at the start of the initiative. Again, the field poll will probably be coming out with updates on these two ballot measures shortly after Labor Day. We're actually in the field right now doing what we consider kind of our Labor Day poll, which is kind of the kickoff to the campaign season poll. But we'll have at least a prior measure because of this survey on these two ballot measures. So it'll be interesting to see if those numbers hold and what the trend lines will be on those as we move forward. That's pretty much what I have to say today. Now, one thing, if you do want to see it, we did prepare press releases. They are housed at the Field Poll website, www.field.com/Field Poll Online. You can see what we wrote. Pretty much what I'm saying today is in those press releases, but they have all of these graphs, and they have the wording of each of the questions and a summary of the methodology of the poll. So if you're interested, that's where you should go. Thank you very much.